Hello and welcome to Askimo TV. I'm talking today to Dr. Ruben Kannan. Dr. Kannan is a plastic surgeon at the Dr. Chambers Aesthetic Clinic in the UK in London. Hi Dr. Kannan, how are you?
I'm fine, Joanne, thank you.
Dr. Kannan, let's talk today about breast surgery. What is breast augmentation?
Breast augmentation is a surgical procedure. It is undertaken to make the breasts more apparent. Now, we do not recreate breasts. All ladies have breasts, no matter how small they are, they all have breasts. But what we do is to bring it forward. And essentially it's a bit like this. If you were to look at a valley or at a sort of a housing complex, all the houses look the same. They don't look any different from another. But what we do is we put one of the houses, it's a breast, on a hill so that it's more apparent. So all we do is we project the breast forward to make it look more apparent. But the breast stays the same. It's just that it is more visible. So that's what an augmentation procedure is about.
Who's an ideal candidate for breast surgery and who would not make a good candidate?
I think it depends on the type of case that you get. You can either get patients who need breast reconstruction, for example, patients who've had cancers, poor things, and have no breasts, in which case we augment or recreate something of a breast mound. But in the cosmetic sense, the ideal patient is the patient who understands the procedure, who understands that there are risks involved, and who knows exactly what she wants. Those are the patients who tend to do the best. Now, breast augmentation, there are people, many ladies, beautiful ladies, who walk around with A or B cup sizes. There are many celebrities who do that, and they're absolutely comfortable with themselves. Equally, there are many patients who have lovely C or D cup breasts who are not comfortable about themselves. So they have to come, I suppose, be at peace with themselves and understand why they are asking for it, more than, it's just a breast volume, it's just a breast cup. They have to be comfortable with themselves. And those are the best patients. Patients who are at peace with themselves, who understand exactly what they want. They do the best.
What should people know about the risks involved in breast surgery?
Yes, it's very important to understand the procedure involved and the risks involved. Now, with breast augmentation, in the past, previously we used to use silicone implants. And essentially, the implants, basically, it's a bit like a jam donut if you've eaten one. Now, it's got a shell on the outside, and it's got a jelly on the inside. And almost all of the time, the jelly or the shell is made out of silicone. There are some implants which are made of polyurethane, which are also good. And the difference between the implants is mainly what's on the inside to make it soft and supple like a breast. You can either fill it up with salt water or silicone jelly, or some of them are absolutely solid, like a foam. And I think it's important to note that this is the difference between the different implants that you have on the market. There are various types of breast implant. You might have heard of the PIP implant, but essentially it's all about quality of the implants. You need to make sure that the implants which are being used are of good quality, have a long track record of being safe, and along that, apart from that, the risk of the surgery, as with any surgery, the risk of bleeding, infection, but the most pertinent one is capsular contracture. Whenever any breast implant is put in, your body forms a capsule around it to shield it from the rest of the body, and sometimes that can distort the breast and be painful. The risk of that happening is higher if you use low quality implants like PIP implants. PIP implants are of low quality, their shell is much thinner, and what's inside them is not really highly purified silicone. They have a lot of impurities. So they tend to break up more often, and if they do, they can cause a lot of inflammation around the breast, and that can be quite painful for patients.
Dr. Kannan, just to end off, what do you tell your patients they should or shouldn't do in order to recover as quickly as possible post-op from their augmentation?
I think the important thing post-op is make sure that you take enough painkillers after surgery. Arrange your life around it, because a breast implant, for example, that one that's under the muscle, would cause you difficulty in doing some daily activities like driving. So make sure your social circumstances are well looked after. Make sure that someone with you at all times after the surgery, because you won't be able to cope at least for a week or two. And those with children particularly, this is important. It's important to look after the wounds, keep it clean, keep it dry, and if there are any problems, you notice any pain or redness, see your doctor immediately and nip things in the bud. These are simple things, and if followed, you will do well.
Thank you, Dr. Kannan. Thank you so much for talking to me today.
You're welcome, Joanne.